Hi everybody, my name is Dr. Scott Giacomucci. I'm the director and founder of the Phoenix Center for Experiential Trauma Therapy in Media, Pennsylvania. I'm board certified in clinical social work, in sociometry, psychodrama, and group psychotherapy, and my specialty is in trauma and traumatic stress. I'm really excited that you found this video, and I hope that you do find it helpful in your work. So in this video, we're going to be talking about trauma. What is trauma? So trauma is simply an emotional response to a distressful, disturbing, and overwhelming experience. Trauma is really a subjective experience in that two people could experience the same event, the same disturbing event, and they would have different responses to it. One person might have a traumatic response while the other person doesn't. Actually, only 1 out of 4 adults develop post-traumatic stress from a traumatic experience, while at the same time 1 out of 2 children who experience a traumatic experience develop traumatic stress response. So trauma really exists on a continuum. It's a word that is becoming more and more popular in our culture, more and more popular in clinical spaces. It used to be reserved specifically for military veterans, and that's where the history of the diagnosis PTSD can be traced back to. It actually wasn't until 1980, about 40 years ago, that PTSD was recognized as a diagnosis. And ever since then, our acceptance of trauma and its pervasive impacts within our society is becoming more and more accepted. So trauma exists on a continuum. I like to think of the difference between capital T and lowercase t traumatic experiences. One way to think about it, capital T traumas would refer to traumatic experiences that most people would look at and say, hey, that sounds like, or that looks like, that feels like it would be a trauma. Things like rape, things like war, things like violence. However, at the same time, there's also lowercase t traumatic experiences. These are the types of events that not everyone might categorize as traumatic. Things that certainly have the potential of causing traumatic stress and impacting people throughout their life, but sometimes go unnoticed, unidentified as traumatic. A simple example is a prolonged and reoccurring experience of bullying as a child. This is something that we may or may not label as traumatic. However, when we look at how it impacts one's sense of self, one's sense of trust and relationships, one's beliefs about the world, one's arousal and reactivity in their nervous system, their avoidance or dissociation, certainly has the potential of developing into PTSD symptoms. So lowercase t traumas certainly can lead to PTSD. In my work, I like to use a really inclusive definition of trauma. And that definition includes neglect, it includes abandonment, and it includes more complicated and traumatic types of loss. I think in the field and in society, unfortunately, we often neglect to consider how harmful neglect and abandonment are. It's less easy to identify as active traumas, where there's clearly an event that was traumatic, whereas neglect and abandonment are the absence, the lack of having needs met emotionally or physically or socially. In my experience as a trauma therapist, as a clinician, neglect and abandonment sometimes are even more difficult to heal from than active traumas. So I like to include them in my definition of trauma. Trauma, the word trauma, actually can be traced back to the Greek language, and it means wound. So one thing I've been thinking about recently is how in the medical field, when we talk about trauma, we're talking about the actual wound, the physical wound. Whereas in the social sciences and in pop culture, when we talk about trauma, we're usually using that word to describe the experience out in the world. So I think it is helpful to reconsider how we're using the term trauma and to use it in really specific ways. There's many different types of trauma. There's single incident trauma, there's complex trauma, reoccurring trauma, shock trauma. There's relational trauma, trauma that takes place within the context of relationships. There's a thing called collective trauma, which is when an entire group of people experience a traumatic experience simply based on their group identity, based on their collective identity or experience. Of course, there's racial trauma, there's financial trauma, even ancestral trauma. So there are a lot of different categories and different types of trauma. It's important also to consider that our experience of trauma is situated within culture, within the belief systems and the ways that we make sense of the world. So I think this is one of the reasons why two people might experience the same event, and one of them might experience it as a traumatic event, whereas someone else might not experience it as a traumatic event. The way that we perceive the world, the way that we make sense of the world, the way that we integrate and process our experiences is significantly related to our cultural background, our religious background, our racial background, all the different belief systems that we hold and that we use to interface with the world. So whenever we're working with trauma, it's also important to consider cultural factors. Another thing that comes with working with trauma is that many people don't want to talk about their trauma. It's hard to talk about. It's painful. Some of the neuroscience research even shows that when someone is asked to remember a traumatic experience, the left hemisphere of their brain, which has to do, generally speaking, has more to do with rational thought, with language and speech, decision-making. The left hemisphere of the brain is mostly offline, whereas the right hemisphere of the brain is overactive. This includes the Broca's area in the left hemisphere of the brain, which has to do with speech and language. So when we ask someone to remember or to talk about a traumatic experience, there's less activity in the speech and language part of the brain, which kind of supports what we already know and see and feel, that it's difficult to talk about trauma. Sometimes we don't have the words to express our experience or our feelings about trauma. These findings really challenge us in the trauma therapy field to consider some alternatives to talk therapy, to bring the body into treatment, to consider the importance of relationships in healing, to not only focus on talking or thinking or cognition, but to really offer more holistic approaches. So while some clients might not be willing to talk about their trauma, others may have experienced distressing experiences and they simply don't label them as trauma. And some clients might not remember the traumatic experiences that they've had in their life. It's actually quite common for traumatic experiences to be suppressed, for someone to have no conscious recollection of a traumatic experience. This is especially common when the traumatic experience takes place in the first few years of life. The part of the brain that holds and stores memory, called the hippocampus, it doesn't actually fully develop until someone's 2 or 3 years old. So for someone that's experienced trauma before they were 2 or 3, they're probably not going to have any memory of it. Similarly, when we experience trauma that's overwhelming, the stress hormone cortisol has the potential of impacting our hippocampus's ability to store memories when we're overly stressed. This includes when we're experiencing overwhelming traumatic stress. So there are cases, pretty common, where someone doesn't remember a trauma that they experienced, or they remember bits and pieces of it, but they can't remember the entire memory. It's quite common for traumatic memories to be very fragmented and incoherent, for them to feel very fuzzy, and for traumatic memories to surface at different points in someone's life. They might not remember a traumatic experience right now, But later on, once they feel safer in their life, and safer in their relationships, and safer in their therapeutic relationship, traumatic memories might start to resurface. They might start to remember things that were previously forgotten. So when we're working with trauma, it's important to take all of this into consideration. If you're interested in learning more about how to work with trauma specifically, I encourage you to check out some of the other videos on my YouTube channel here.